Hi, I'm Isabel Medrano.
Hello, Isabel. This is Dr. Mohammed speaking. So this is your patient. Miss Winanki. So her name is Sakina. She's saying hi.
Hi. Can she
Yeah.
tell me her age, please?
So shekaran ki nawa? So her age is 25 years old.
Can she tell me a little bit more about herself, like her family?
All right. So tana so ki dan mata bayani akan ki ne. Kina da aure, kina da yara, kina aiki ne? Eh? Okay. Yaran ki nawa? Yaran ki biyar? Okay. Yaran ki biyar aihuwa. Kina da yan biyu ne? Okay. Sai kuma kina aiki? All right. That she is married. She has 5 children. And she's not working. She's not gainfully employed. She's a full-time housewife.
Can you ask her if her diet has changed recently? Or if
All
it's
right. So yanayin cin abincin ki ya ragu ne kwanan nan? All right. So she said yes, it has actually changed recently.
can you ask Sakina what has caused that? If she's been more busy, tired?
Okay. So mene dalilin? Kina aiki da yawa ne ko har baki samun lokaci ko kuma mene ya faru? Eh? Rashin cin abincin? All right. She says she has been sick, so that's why uh, she's not. Her diet has reduced. Actually, she's not able to eat much recently.
Sorry to hear that, but hopefully by the end of this diagnosis, she'll be treated and she'll feel a lot better. Can
All
you
right.
ask her what other symptoms she has
So
noticed
me,
in the past couple
so
days?
me kuma kike ji banda wannan? Me kike ji kuma? Banda rashin cin abinci sai na rashin lafiya. Akwai zazzabi ne ko ciwon kai ko sai me kuma? Sai me? Okay. Sai me kuma? Okay. Shikenan. Ba wani abu daban. All right. She said she has fever, she has headache, and she has dizziness and body weakness.
Has she been taking any medication for the fever?
So kin akwai kafin ki zo asibiti nan akwai magani da kike sha ne kike samun sauki zazzabin? All right. That she used to take antipyretics, but it will just work for some time and the fever will come back.
Can you ask Sakina how long this fever has been happening for?
So yanzu zazzabin nan yanzu ya dadewan shi? Kwana nawa ko sati nawa? All right. She says she's been having this fever for about 9 days now.
So, since it's been consistent, can you ask her if we can check her temperature?
All right. Her temperature checked is 38 degrees Celsius.
As for the weakness, can she explain more of where she's feeling weak?
So kina jin karfin jikinki ne? Ina ne ba kya jin karfin? Sauran jikinki fa? All right. That the weakness is generalized, so all over the body she feels weakness.
And as for the dizziness, can she explain more when it happens? Is it because she's not eating as much as she used to due to being sick, or is it some other reason that may be
So
causing this?
jirin nan bayan kin fara rashin lafiya ne ya fara ko kuma tun da kina jin shi? All right. She said the dizziness started when she started having this fever. So that is when the dizziness started.
So asking her these questions because I want to narrow down what diseases she may have. The
Okay.
not eating can be anemia, the fever can be malaria or typhoid since it is happening for the past 9 days.
Okay.
Headaches, there are also symptoms such as weakness and dizziness. So I
Okay.
would want to run some tests if that's okay with
Oh,
her.
all right. You can go ahead.
So I'd like to run a rapid diagnostic test for the
Okay.
malaria.
So rapid diagnostic test done for this patient revealed two plauses of malaria.
As for the typhoid fever, I'd like to run a blood culture test, if
All
that's okay.
right. So blood culture done for this patient reveal yield colonies of Salmonella typhi.
And as for the anemia, a full blood count.
Yes. Shit. Not enough.
Doctor, you froze. Hello, Dr. Muhammad.
Hello, Isabel. Nice to see you back.
Nice to
So
see you too.
yeah. So you can continue from where we stopped.
Yes, I was asking about the anemia since she hasn't been eating too well, and I
Yeah.
wanted to run a test, the full blood count, the hemoglobin levels.
So the hemoglobin level for this patient is 11 grams per day.
Okay, so she seems good.
Yeah.
The food could probably be from it's from the malaria, probably
Yeah.
the loss of appetite.
Of course.
So as for the treatments for the malaria, I'd like to give, since it's not too severe, there's no anemia. The treatment would be an ACT, which is a ard artemisinin combination therapy.
Okay, that's good.
And to prevent that in the future, just um, try to avoid mosquito bites.
Okay.
Sleep with the netting.
All right.
And since she does have her children, for them as well.
Okay. So that's correct. Um, Isabel, you have done well. From the symptoms of this patient, you were able to suspect that she might be having malaria, and you also went ahead to actually give the correct investigation, rapid diagnostic test for malaria, which shows that she has two plauses of malaria. You also went ahead to think if she might be having anemia because malaria usually gets complicated by anemia. So this patient has the anemia is not very severe, and also you suggested the correct treatment, which is artemisinin-based combination (ACT) for this patient since the malaria is not that very complicated. So you can give her the ACT, which is very correct. You also went ahead to suggest possible means of future prevention so that this patient should not come back after some days with fever again, sleeping in mosquito netting. And also for her children, that's very good because the children are also more very prone to malaria because of their low immunity. So also you and also mosquito netting and wearing of long pants and long sleeve shirts. So you have done very well, Isabel. So congratulations.
Thank you.
Yeah.
Can you tell her that I hope she feels better?
All right. So tana miki godiya kuma tana fata Allah ya saki samu sauki. So she's also saying she's very grateful for what you people have done to them, and she's very happy.